In this video, I'm going to talk about fluorosis. And I can't talk about fluorosis without touching on the complicated topic of fluoride. This video is for anybody who has spotted teeth. This is something you may have noticed if you go up to the mirror and look closely. Do you see white spots or dark spots or maybe slightly golden colored spots? Now, not all spots are what I'm going to talk about. Sometimes these spots could be something that occurred, something that just happened. And that could be decay, or it could be just staining on the outside of your teeth that needs to be brushed away. What I want to talk today about is the kind of spotted teeth that occur. When your teeth come through in your teenage years, you notice that they're covered in little spots or little clouds, white ones, slightly golden ones, or even brown ones. This is a problem called fluorosis. And I want to distinguish between fluorosis and problematic things that can occur to your teeth, but also I want to use this as the beginning story of fluoride. And I think many people don't know how come we put fluoride in our drinking water. When did it happen? How was it decided? And actually, the story of fluoride begins with a dentist in the early 1900s, not thousands of years ago, but just in the beginning of the 1900s, with a young dentist who was working in Colorado Springs. And this young dentist was very observant and obviously a great dentist. Looking at his patient's teeth, he noticed that lots of children had markings on their teeth. They had these little white spots or they had little brown spots. Long story short, he noticed that year after year, all these children in his practice continued to show the spotted teeth. So he made documentation of this. And this was, of course, long before we had any internet. So he wrote letters to different dental organizations. And he enrolled other people in his project to try to find out what was causing these white spots in teeth. And he actually enrolled the help of a very famous dentist, G.V. Black, who was the dentist who actually helped write the manual virtually on dentistry, how to do fillings, how to make a filling stay in a tooth. And these two gentlemen together took drawings, illustrations, early photographs of these stains around the world. At these dental meetings around the world, they found that there were countries, there were places all around the world where similar spotted teeth were occurring. Dentists had noticed this in other countries. Well, it took Dr. McKay, the young dentist in Colorado Springs, took him 30 years to sort of figure out why this was happening. And what he discovered was that something, he didn't know what it was, but something in the water that the people were drinking in Colorado Springs was, he believed, the reason for this spotted tooth patterning. And so he arranged, he must have had quite a lot of trouble to do this, but he arranged for the drinking water in his neighborhood to be changed. And in actual fact, what has been discovered was that 10 years after he changed the water supply, there was no more staining on these teeth. No, it wasn't staining, but actually spotting. And at this point, that could have been the end of the story. We're now talking about the 1930s. And it could have just disappeared. But during his investigation, going to dental societies, reporting what he saw, other dentists became interested and started looking in their practices. And it turned out that staining was being seen in 26 other states. And so the government health authority got involved. There was a gentleman called Trendley Dean who was sent by the government to explore what is this spotted tooth thing going on in 26 American states? And Trendley Dean spent, again, another 10 years investigating in these dental practices and the people who had reported this spotted tooth problem. And he was looking at the severity. How many children had mild white spots? How many children had more intense spotting? And how many children had these brown, kind of mottledy, where the surface of the enamel was damaged? And he actually gave the name fluorosis to this problem because he was able to see that the more fluoride naturally occurring in the water supplies, the higher the level of fluoride in the water that these children were drinking, the more mottling occurred. And the original intent, just like Mackay, he was going to redirect the water supplies, but obviously that wasn't practical for every single city where this was occurring. So the intent originally was to remove fluoride from the water supplies of these cities where the children had the brown, dark, mottled, spotted enamel. And with the help of G.V. Black, who is this famous dentist, and Dr. Mackay, and also Trendley Dean, they all got together and started to try to figure out what is actually happening. How come these adult teeth have this spotting on them? And what they discovered, fluorosis, which is either mild, medium, or severe, occurs when children between birth and 6 years old consume, ingest, take into their bodies, actually absorb into their body systems fluoride, and then this fluoride travels around their body. And the problem is the most sensitive cells to fluoride happen to be little tiny cells that are in the jawbone of this child younger than 6. And those cells are called ameloblasts. Once you're 6, once you reach teenage years, you have no more ameloblasts. If you're an adult, you don't have to be scared. You can drink fluoride and it won't hurt any ameloblasts because you don't have any. The ameloblasts are only in your jawbone when you're a child. And so this fluorosis can only occur and damage teeth that are forming. And the way that the fluoride damages the teeth that are forming is because the fluoride is actually toxic, hurts the ameloblasts. And ameloblasts are these little cells in the jawbone that secrete or actually pump out enamel. They are the makers, they are the formers of the tooth enamel that coats the outside of adult teeth. So if your baby is given fluoride or is drinking it, or you're mixing up formula milk with a fluoridated water, that ingestion of fluoride will go around the baby's body and will end up damaging the very cells that create adult tooth enamel. There are other hazards from too much fluoride ingested in this way. It can also affect the thyroid, and it can also affect the skeleton. That has been known since this beginning of this fluoride story in the 1930s. In India, for example, a lot of the knowledge we have of high levels of fluoride came from India, where in the soil there is a lot of fluoride naturally occurring. What was going on in Colorado Springs, just for your interest, is that Pikes Peak, the mountain there by Colorado Springs, has a particular kind of geographic or geologic structure. And when the snow melts in the spring and filters through this kind of layer of the soil, it picks up the fluoride and used to flow through the water. And that is how Dr. Mackay and his patients, that's how the story began. Fluoride is naturally occurring. At this point, all that they were looking at was the damage done to ameloblasts by naturally occurring fluoride that was found in the water supplies around the world, in parts of America, and in these specific cities where they had noticed this staining. This is where the story gets really interesting, because at that moment, there was also a problem with this kind of staining occurring in a factory setting around the Aluminum Company of America. And it's just very interesting that the byproduct of aluminum manufacture happens to be fluoride. And early in the beginning of Alcoa, which is the Aluminum Company of America's, soon after it was initiated as a company making aluminum metal, there was a need for fluoride because it was used as a pesticide on plants and vegetables and for growing things. They would spray these in these fields of agriculture. They would use a powder of fluoride, and that was the use of this byproduct from the aluminum manufacture. Now, it just so happened that stronger chemicals came along, which were more effective as a pesticide, so fluoride was no longer used in that way. And I suppose the company just let it go out into the water around the company. And the dentist in that area noticed that the children around the aluminum manufacturing facilities had these similar spots on their teeth, and hailed Trendley Dean, our friendly now. He was enrolled in the National Institute of Health with the dental health component under his wing. And the Aluminum Company of America called him to come see what was going on around their factory. The owner of the Aluminum Company of America, they were very interested in what was going on, and they had an association with the Carnegie Mellon Institute, which was in those days an institute that was somewhat involved in chemistry and structure of metals and so on, in looking at the sciences. And they decided they would look into this whole thing of water fluoridation. So Trendley Dean started working with the Aluminum Company of America and the Carnegie Mellon Institute. One of the things that Trendley Dean had noticed was that when any of these teeth had this mottling, the extraordinary thing was they had no tooth decay. There was no decay. There was no caries. There was no cavity in any of these children's mouths. That was extraordinary, and that was different. And in America, in the 1940s, the early 1940s here, the military were noticing this incredible amount of decay in the young soldiers' and military mouths. Many of these soldiers had terrible tooth decay. So I believe at the beginning there was an epiphany that seemed to make a lot of sense. It seemed like a good idea to, instead of taking all the fluoride and just disposing of it, could they add just enough fluoride to stop the cavities and keep the mottling from forming? And the goal was this kind of grading, because Trendley Dean knew the more fluoride, the more dangerous mottling. It became brown and pitted and bad. But if the amount was tuned down, could he get it to a point where the mottling was virtually imperceptible, but the fluoride had this effect on making the teeth stronger and more resilient and resistant to decay? That's when the American Dental Association got involved. There were dentists arguing that this was too much fluoride, it shouldn't be put in the water. There were others wanting to do it. There was the Carnegie Mellon doing all the studies. There was the government involved. There was a big brouhaha going on. And they took a place called Grand Rapids in Michigan and started doing studies where they were adding artificial fluoride. Now, for the first time, this is 1945, years later, they are practicing basically adding a little bit of fluoride. Could they get less cavities, and no mottling. That was the intent. Well, they did. They added it, they approved it, they endorsed it. We have had fluoride added to the drinking water in many, many states ever since. And in my next fluoride video, I will get into the ways that fluoride can be useful, the ways that fluoride can be toxic, the different kinds of fluoride. I'm not going to talk about that now. I want to go back and focus on this mottling, on these spotted teeth, because I have a personal story. You see, in 1977, as a young dentist, I had been practicing for some years at that point, and I had a child, and of course, I had been trained that fluoride was really important, and I should give it to my children if I wanted them to have strong teeth. Think about it now. 1945 is when they started putting in the drinking water. So for 30 years, dentists had been trained. We need this. We need to drink fluoride. So I added fluoride to the baby bottles, to the food, to the water, for all three of my older children, born in 1977, 1979, and 1980. And those children grew up all the way through until they came to America in 1980. I continued to give them fluoride. And in 1984 was for me the watershed moment. For 7 years, I had been giving my children fluoride drops every day, the way I had been trained to do. In 1984, my oldest daughter started to erupt. The new teeth began to come through in the front of her mouth. And I was shocked, horrified, and dismayed to find they were brown. She had chocolate brown front teeth, and they were mottled, and they were rough, and they didn't look like front teeth are supposed to look. And when I examined the back of her mouth, she also had problems with the molars that had come through at the back of her teeth, but I really hadn't noticed those. I had only begun to see the problems on her anterior incisor teeth. So the story here was that in 1984, as a new immigrant to America, I was retaking my dental licensing exams, and I was at the University of Rochester in New York. I had access to the Minor Library, which is an enormous medical library. I am so fortunate to have had that resource at that very moment in time. And I had to do a research paper or a thesis on something, and I chose fluoride. And I spent hours and hours and hours in that minor library researching, trying to find out why did this was my first child. My second child, when her new teeth came through, they had white spots on them. And I have the gradation from severe to mild fluorosis in those three older children's teeth. Perfect example. And I was so upset. And I learned this story of the Aluminum Company of America, of Decay, of Grand Rapids, Michigan. I understood what they were trying to do, but I was also motivated to tell mothers, do not give your children fluoride to drink, to ingest between the age of birth and 6 years old. You may have been told, make sure if your child is brushing their teeth with a fluoride toothpaste to spit it out. You don't want your child consuming this. But I was also a dentist with great experience at that moment in time. I had worked in England for over a decade in a practice with very high decay rate patients in a community where cavities were everywhere. And we didn't have fluoride in our drinking water. And so I had told my adult patients, because I was mainly seeing adults at that time, and special needs children, who rinse your mouth with fluoride, brush your teeth with fluoride. And I had seen such incredible benefits that this is the very difficult position I found myself in. I am a mother, very angry, that I had given my children fluoride to drink that had damaged their teeth, may have damaged their thyroid, may have done other harm to them. I am angry that I didn't know anything about this. I didn't know the damage potential for the ameloblasts, and I would like to share that with you. But I also want to share with you the incredible benefits that I have seen, and I have now seen for 50 years, when you brush the right kind of fluoride in the right dilution on the outside of your teeth and you spit it out. And that is what I've been teaching people, that I live this line down the middle, not being against all fluoride, being against drinking and consuming more than you want. And I want to add in here, which I will do more in my next video, but fluoride is naturally occurring. It's in the soils. It's ubiquitous. It's everywhere in the world. If you drink tea, there is a lot of fluoride in tea. If you are worried about fluoride, be worried about drinking too much iced tea because it has a high level of fluoride content. So to say I refuse to be part of fluoride is not where I'm going. But I am in great empathy with people who've heard stories that what we add to drinking water or fluoride is a toxin, or some parts of these stories will fit together. And I'm going to try and fit them like a jigsaw puzzle so that you have a clear picture of which kind of fluorides are safe, how can you use it to protect your teeth, to protect your children's teeth, when should you start using fluoride, how do you use it, what does it do when you use it differently, and how to avoid causing any of this unnecessary damage to developing adult teeth in the baby's jawbone. And that is what we're going to cover in the next fluoride video. So just to recap, if you have mottled or spotted teeth, or you know you have fluorosis, then I would highly recommend you use xylitol and the strategies that I recommend to strengthen your teeth, to build up more strength in them, because part of the problem with fluorosis is that you have voids, you have weakness in that enamel structure. And the minute you can start doing this, the better. If you have a child and their new teeth come through and they've got white or mottled, spotted teeth, don't, whatever you do, go and artificially whiten them. That would be the worst thing you could do, because that will take strength out of them. We want to put strength back into them. The very best way to do this is end meals with a little bit of xylitol, and then allow an hour or so between meals where your saliva, because that is full of the minerals that these teeth need, allow time for those minerals in your liquid in your mouth to go into your teeth to mineralize them. You can also use a good fluoride toothpaste like the ones I recommend. You can use a dilute 0.05 sodium fluoride mouthwash to rinse and spit out. And I would begin that from a child. You're going to be seeing these teeth at 6, 7 years old. You can use those fluoride toothpastes and mouth rinses on those children. Just supervise them. Help them learn how to rinse and spit. And then combined with xylitol and dilute fluoride work synergistically. They will work in harmony. Xylitol will help mineralize teeth. The use of a fluoride toothpaste and mouthwash will speed that process. If you already have this mottling, I would highly recommend my Complete Mouth Care system to you for those reasons. If you have a child and you've been giving them fluoride supplements and the child is under the age of 6 or 7, in fact, children do not need fluoride supplements. That should be stopped. And I would not recommend giving your children a lot of drinking water that contains fluoride. If you live in Austin, for example, where I live, we artificially fluoridate perfectly good drinking water here in Austin, and I would not use that for a young baby. I would avoid that, and I think we can talk more about fluoridation of water because perhaps we can make change moving forward.